We've got some fresh claims this morning. It's in the Herald Sun. Residents in aged care homes, they've starved for days. They've been left unwashed and in soiled sheets. What's your reaction to those kinds of stories?
Pete, I'm very sad because we had good lessons really to be learned from Dorothy Henderson and then from Newmarch in Sydney. And we know what should be done. So there is a guide for the first 24 hours when you have an outbreak and what to do. But what happens is it's really been a big stress test on the management and the staff, and it hasn't been able to stand up to this. So then things go into chaos, they lose communication, staff are moved out and staff come in too slowly. So it's a situation where chaos sort of builds from day to day. If you don't get this right from the beginning and make the right decisions and move people carefully and look after them and communicate, then you end up with this sort of chaos, which is dreadful.
Are residents being neglected?
We have reports that some are, and that's when you've got the chaos. Everybody's trying to get things done but can't do what they're supposed to do. The staff are not familiar with the institution because sometimes you have to move all the staff out because they have to go in quarantine and isolate.
But that's a disgrace that that's happening, though, Professor, isn't it?
Absolutely.
That is actually happening. And you quite rightly point out that, you know, the lessons of Newmarch House should have been learned.
And Pete, they're in writing. It's a problem to get those through, and I think that's where we've had problems with the workforce in aged care. It's not that they're not all trying, it's not that they're not doing their best, but the training is not there, the skill sets are not there, and I think in this case, now this is a really different thing, and you have the guide for the first 24 hours, but you haven't practiced it, so when it hits, it hits too hard and people fall apart. So no excuses really. This just has to be fixed up.
I mentioned a couple of stories off the top there, those fresh accusations from the Herald Sun this morning. What are you hearing? What are the National Seniors Australia hearing at the moment about what's going on?
Well, you're hearing the same sort of stories. You're hearing about a failure in communication with families, and that's again part of the chaos going on inside. So people not really knowing what's going on and then suddenly finding out that someone's died, which is a really terrible way for someone to lose a loved one. A range of things like that, total lack of access for family. And remember that family is part of the scene. Family are part of the people who often feed with someone with dementia. They may well have been coming in before and feeding that person. Yeah, not good news really, Pete.
No, and the state and the federal governments, they're starting to blame each other now, so tensions are really starting to fray. Who is to blame here, though?
I think it goes back in time a bit. We should have had better training, better skill sets. We should be really, I guess, assessing people. We have an industry that's coming out of being a cottage industry, being something done by charities and community groups and so on, religious groups and so on, and now coming into being actually a serious business. And we're looking at that sort of industry struggling with this. This has got to be fixed. So a number of things. We have a Commission for Safety and Quality. It's only been reformed a bit over 12 months ago. That's got to get working. And we've got a Royal Commission that's going to make statements on this that have got to be implemented and fixed.
We had the Federal Health Minister, Greg Hunt, say yesterday that this crack team of this crack medical team is now heading in. Should they have been brought in earlier? Should Daniel Andrews have banned elective surgeries earlier? I mean, who is more at fault here?
I think these things grow like topsy and people kind of struggle to respond. I mean, again, we didn't know it was going to be this big. It sort of grew by the day and then grew out of control. It's certainly needed now. When it should have come in, I think we'd all say earlier, but just when it should have come in as a critical decision. And you do need that when things are collapsing underneath. You do need that group coming in. This isn't like running a care system. This is military precision, doing things on the spot, doing them right, but you've got to get going.
The AMA wants a Royal Commission. Do you support that?
Look, I think we've got one, really, and there's an inquiry into things there. Look, I think these things are, if they're not visible now, they should be. We should be able to document these and, again, learn the lessons and solve this problem as well. And I'm just as worried about people at home, Pete, who are not in nursing homes, who are still locked down in Melbourne.
Yeah, and there is that too. Now it seems as though staff are going to be getting paid pandemic leave. Do you have concerns about that leading to staff shortages?
But part of the reason for that is we've got staff who are underpaid, who are, one of the low-paid groups in the workforce, and they're working at a number of institutions. So you don't want them to go across from one to the other and then suddenly find out that there's been a spread of the virus through that sort of movement. So I think that's very important that we support those people. They're low-paid. They need the money, so they can't just stop going to another facility. I think that's the main cause of that.